Welcome back, guys. It's Dr. Somji.
And it's Dr. Solomon here.
We're going to be talking about a laser that we both use a lot of in the clinic for various different indications. It's probably the most popular laser worldwide. It's called a CO2 laser.
Okay.
So what is a CO2 laser?
CO2 laser is an invisible infrared light that delivers energy in the form of heat. And that heat is used for certain treatments, resurfacing of the skin, ablation of the skin, and we use it to treat certain conditions, which we're going to talk about in this video.
Yeah, absolutely. I mean, look, like with anything in what we call regenerative medicine, you're causing specific damage to promote wound healing. So you're harnessing the powers of your body to essentially improve. One of the benefits that I have with CO2, if you look at probably in comparison to our microneedling video, CO2 not only stimulates collagen, but it also resurfaces as well through ablation. So ablation means that that outer layer of the skin is basically taken away.
So you're essentially cutting the skin.
Yeah, you can smell it.
Yeah.
Procedure. Obviously, we use vacuum and things like that, so you don't smell it, but you can smell. Obviously, you know, that outer layer of the skin that's basically been burnt away, selectively burnt away.
Yeah.
That's the key.
So actually, it's a double function of the lasers to not only cause that injury that we talk about in other videos to stimulate collagen, but you're actually physically polishing the skin.
Absolutely, yeah. So some of the traditional lasers that you may have seen with CO2 were like fully ablative. What that basically means is that, you know, all the energy was put as almost as a stamp. Nowadays, obviously, we have pixelated lasers which are fractional, but they can so that you've got those little pin dots, almost like the dots on a dice, and they leave tissue that has not been treated. So you get shrinkage, and also the downtime is not a lot. When you've got one block of energy just as a whole stamp, that can take sometimes even months to recover or not recover at all. So the things about side effects, as we'll come on to it, go a lot higher. But that's why everything is pixelated, and the closer those pixels are together, the more aggressive the treatment. When people are talking about ablative, non-ablative, is really how deep it goes. So does it remove that epidermis, the outer layer of the skin, and get down to the dermis to promote collagen? Or is it just very light on the top, which we normally say is like non-ablative lasers?
Yeah. So you can get different types of lasers, and you can get different depths based on the energy used of that laser.
Absolutely. There's so many different things that denote how aggressive a treatment is, and it's all dependent on your skin type. So yes, power is one of those things. The only 70-watt laser worldwide is a hybrid laser made from Alma Hybrid. It's called the Alma Hybrid. CO2 is a 70-watt laser. That's like the highest power that you can get. Most high-powered ones, you've got some kind of luminous ones, which are like 50 watts. And then the standard CO2 ones, which are like kind of up to 30 watts, and then some of the cheaper CO2s are like 20 watts. They don't have enough power, so that's the power that comes out.
So the higher the energy, possibly, you could argue that the better the result.
But also the more dangerous.
The more dangerous. Well. So let's talk about potential side effects and the dangers of that, because you can't just blast the skin with high energy.
No, like I mean, if you're going to blast it at very close pixelation, almost fully ablative in every way, if that makes sense, then you've got issues like more pigmentation, which can happen with things, so hyperpigmentation, complete loss of pigmentation through scarring, so hypopigmentation. And if you're doing it around the eye area, it can contract too much, so that your eye may not even close as well. So it's really important that these settings, and you do it in sessions, that they are not so aggressive from the outset, because there's always going to be a large cohort of patients that really don't recover so well. How long the laser stays on the skin for, that in darker skin types, the longer you stay on, the more chance of hyperpigmentation. So if you've got someone with my skin type, you might have high power but shorter dwell time, and then also you might do a couple of passes and the pixelations may be a little bit closer so that you still get good energy. Someone like you might be able to get away with double pulse or a longer dwell time on the skin. So even though the power, you can lower the power but increase the dwell time, and the power of the treatment, the aggressiveness of the treatment could be a lot higher.
How do we know all this? How do we know how much energy to use?
This
and the
is
pulse
experience out of treating thousands of patients like we both have done. Looking at feedback, obviously at Dr. Many Spa we always have like protocols for each and every skin type. I perform, you know, CO2 laser treatments mixed with erbium glass treatments, we're using the Alma hybrid in darker skin types, so even type 5, type 6, so even Afro-Caribbean, African skin types, we've got safe protocols for it. And a lot of that is not just the treatment, it's also your preparation prior as well.
Yeah.
So things to dampen pigmentation, doing it at the right time, avoiding holidays afterwards, making sure you stick to aftercare correctly. All of these things affect the outcome and also have a great impact on the safety of the treatment.
So essentially preparing the skin, making sure the skin's in good health, ready to receive the laser so that you can also heal afterwards as well.
Absolutely,
Yeah.
absolutely.
Okay.
So I mean, CO2 laser, I wouldn't get scared. If you see someone that claims that they're going really ablative and they're really aggressive, that's not necessarily a good thing, guys, because that may be great and you'll get some great results, and we have some fantastic results with strong ablative treatments. But listen, look, there are side effects with it too. And you know, sometimes you get this sort of smoothie sort of appearance if people have gone too far with CO2, and the prolonged erythema, so the prolonged redness, which is always a feature of CO2 in lighter skin types. It does eventually fade, and you can have other lasers to help that. For example, DIVL lasers and vascular lesion lasers. But these are all things you need to consider. The CO2 is not a one-off treatment. It does have longer term recovery than other things. Don't forget, on our Instagram page, Dr. Medi Spa, Dr. Somji Skin, Dr. Tina Solomon, we're always talking about different videos, looking at what we're doing in our daily practice, so you'll be able to get loads of insights in terms of before and afters. Don't forget to click like and also subscribe, because we're always uploading new content. If you want us to talk a little bit more about lasers, or you have any specific questions, just let us know in the comments below and we'll be more than happy to help.